All right, we're here with Danielle. Danielle was kind enough to allow us to film her initial visit, her scan, some of her exam, and maybe her first adjustment. And then we'll come back and do another video of her after going over her x-rays, going over the scan in detail, and then doing a follow-up adjustment. Danielle has a bunch of interesting things going on.
That's a nice way of saying it.
Yeah. So neck pain and migraines are one of the reasons she's coming in for.
Yeah.
And she has daily migraines, right?
Basically.
Pretty much every day.
Pretty much every day. Yeah.
Pretty much, where they
if it's
come
not,
from?
it's some kind of headache, yeah.
They come from the base of the skull or
I
go
feel
across
like
your
it's
head?
like here, and then like the main one is right here. It's like they just pulsate, it kills me.
And so every day she has them,
Basically,
constant, pretty much.
Constantly taking migraine medication.
Constantly taking migraine medication.
Tylenol, ibuprofen, anything to kind of relieve anything.
Just trying to get some kind of relief or just some kind of, pain reduction in some way. Also low back pain. Cross lower back, constant.
Yeah. Just like even sitting here, like it hurts like right down here. Like I just want to keep slouching more, like or cross my leg or take some kind of pressure off of it. Yeah.
No slouching.
I'm
You're in
trying.
the chiropractor's office.
Trying.
Fake it if you can.
I'm trying.
Also foot pain.
Yeah.
Right. This you had just a sudden stress fracture. You're not sure how it happened,
Nope.
but you had a stress fracture of, is it the left foot?
Yeah, the left foot.
Left
I
foot.
think it was like misdiagnosed, and they just kept telling me, oh, it's okay, you probably sprained it, and then it turned out fractured. So it was probably, I shouldn't have been putting any weight on it, and it got worse, so yeah.
All right, so she also was diagnosed with Scheurmann's disease, right, which is also a condition of the spine, which is Scheurmann's kyphosis, also known as, and really it's the mid-back curve exaggerates. So if you look at it from the side, you'll get a kind of like a kyphotic increased curve of the mid-back spine. And that could be caused, sometimes you don't know why it forms, sometimes it could be formed over time through posture, and sometimes it could be an accelerated growth rate in childhood, something of that nature. But the vertebra can sometimes be, I don't say malformed, or the front of them can be smaller in height, and it can create that, or it could be acquired over time through posture and some other reasons. But she was diagnosed with that in her middle back. She had a little bit of an increase in kyphosis in here, middle back, thoracic spine. So she has that too, which probably contributes to some of her pain or discomfort. She claims that she's clumsy. She's fallen a lot over the years, which doesn't help as far as creating misalignments.
I am blonde and Polish.
She's
so.
blonde and Polish, which contributes to it.
So I have two things against me. Yeah.
She gets dizzy at times, just gets lightheaded at times. She struggles with chronic fatigue, right? Some anxiety, menstrual cycle, not regular menstrual cycle. She's had that since young. Digestive symptoms, some heartburn, some bloating, some bowel stuff that doesn't necessarily go to the bathroom every day. So her body's struggling for help, right? It's crying out. These are all symptoms. She said that she's been everywhere, has done everything, right? Or has done a lot of stuff.
Basically.
She's done a lot of stuff in the medical realm with medications. They want to now inject something into the base of your skull to try and
to just kind of numb the nerves.
Numb the nerve,
like that.
a nerve block.
Safe to help the headaches and stuff.
She also has sinus issues, which she also had a deviated septum that she had corrected, which made the sinus problems worse.
It definitely did not help.
So
didn't help me at least.
So Danielle's got a bunch of different things here, and our goal is my goal is to get her as healthy as possible, get her body functioning better, find the root cause, find what's causing these things, because it's not because she's lacking shots in her body or medications. Her body is imbalanced, it's struggling for help, and that's what we're going to figure out. So first, we're going to look at her spine. We talked about some other things which we might talk along the way, but nutritional things too. But we're going to start with the spine, because the spine is the lifeline, all right? The spine controls everything. Well, specifically, the spine protects the nervous system or the spinal cord. So your brain and spinal cord sit in the skull and protected by the spinal cord. And life is experienced through the nervous system, right? So the spine is everything attaches into it. All the nerves, these yellow things coming out of the spine, go all the way down your arms, all the way down your legs, in between all your ribs, to all your organs. And if there's problems in the spine, it can affect how your body functions, feels, heals. Make sense?
Makes sense.
So we're going to look at these things called subluxations, which is the word for misalignments, creating stress, tension, irritation to the nervous system, the muscular system, ligament. It causes ligaments to sprain, which causes instability in the spine, and then eventually it'll affect the nervous system and prevent the body from functioning correctly. So this scan initially, the one we're going to do first is infrared. It's going to look at stress in the nervous system. It picks up heat patterns off the spine. It is affected by medication. She's on some medication, but we'll see how with the spine, because we'll see what comes up in the nervous system.
I hope
Because
I don't break the machine. So I'm just saying. That's quite.
well, it'll be entertaining for the people watching.
Start smoking and.
Yeah, we don't know what's going to happen. So we're going to start there. All right, so I'm going to find some landmarks on your spine, okay?
Okay. I'm trying to sit up as good as I can.
You're doing great so far. So I'm just going to find some landmarks here in your lower back.
Because usually by now I'm like slouching or crossing my leg, and it's kind of like what I do to take the weight off the spine. Does that make sense?
Yeah, so you fidget when you're sitting, right? So to try and get comfortable.
Yes.
Whether
So like
you're
sitting like this is like my lower
torture?
back. Oh yeah. So like usually I'm always crossing my leg or shifting or yeah, definitely.
Begin scan. S1.
So we're going to start way down here, and this is a painless, easy test, Danielle. You're going to feel me just
L1.
run up your spine.
T1. C2. Left C1.
I'm going to go behind your left ear.
Right C1.
And go behind your right ear. So, where she has, there's colors here on this body. All right, and so where their colors are stress in the nervous system. Now these go, you can have pain in these areas, not necessarily, but it's just saying that there's a heat reading, there's a problem in this region, in this region, in this region. Now the symptoms could be anywhere, but up here, we talked last night, or during her history, we did her history, she had a lot of pressure at the base of her skull. When she was in here talking about her headaches and migraines, I wanted to talk about or feel her neck. And I found a lot of pressure at the base of her skull, and that's showing a lot right there. The colors indicate the amount of stress or tension on the nervous system. White's within normal range. Green is a mild problem, blue is moderate, and red is severe. So up here, you're having a lot of stress and tension up in the base of your skull, which you're feeling a lot of pressure, which I felt a lot of pressure. Now, if we look at this chart here, and I showed this to you before, upper neck region, headaches, migraines, nervousness, difficulty sleeping, some of the other things I'm reading upside down, nervous breakdowns, anxiety, ear infections, hormonal problems, menstrual, depression, anxiety, digestive. Now, when we just talked a few minutes ago, a lot of her symptoms
Are right
that she's
there.
experiencing are right here.
Maybe like one or two that's not on there. So yeah.
Right, so a lot of pressure up here can create a lot of these symptoms. So over here also, you're talking about C7, thyroid gland, T1, T2, heart and lungs, T4, digestion, T9, T10 in that region, kidneys, adrenal glands, stress hormones, L3, L4 has to do with digestion, large intestine, reproductive system. All right, so you're showing a lot of things here that's showing up on the nervous system that are consistent with what you're experiencing symptom-wise and pain-wise, right?
It's pretty amazing.
Yeah. And you
All
saw
from a
that.
non-invasive heat reading.
I know, right?
And I couldn't influence that test to create this, just so you know, all right?
Yeah, I
It's not
mean,
like magic and all of a
Like what
sudden
you're
I did
saying,
something.
like the different, that's, yeah.
So we're going to save that, and we're going to do the next test, which is going to look at stress and tension in your muscles.
Oh. That's where I'm going to bust the machine. It has to be. Like, yeah. Stress, tension.
Stress and tension, what's that?
They always say.
Do
like,
people have that these days, stress and tension?
No.
So this might be a little chilly. This is just some alcohol to clean the skin, get some dead skin cells out, and also get some good contact. Have you look straight ahead, please. You're doing great so far. You're a trooper.
And this shows, like you said, that the
Yeah.
stress on the muscles.
This is going to look at muscle tension or stress, yeah. So you can have too much, too little, or just enough, and imbalance. So it's going to look at where you have muscle tension that's normal or increased or decreased, but that affects tensions on the spine and the nervous system.
Makes sense. Okay.
What it's not going to show, which it'll show in a printout when we go over this next time, is the imbalance, asymmetry scan. But
Okay.
you'll see right now, like, where you're having muscle activity, if it's normal or abnormal.
Interesting.
Begin scan.
So this is when we start up top here and go down, okay?
C3.
So I'm not going to do much talking during this,
C5.
but same thing, on that body over there that's showing up,
C7.
those colors are where you're showing tension in muscles.
T1.
And again, it's right at the base of your skull, showing up the
T2.
most.
Explains
T4.
possibly the migraines.
Yeah.
T6. T8. T10. T12. L1. L3.
That's where it all hurts right now. I'm sitting.
L5.
That's amazing.
S1.
Seriously, this.
Yeah, so she's showing a lot of stress here in this transition area, in this
Yeah,
area.
this is like where the pain is like right now hurting
Oh,
from
no.
like because way I have to sit and because I'm not doing my.
You're not
you know,
fidgeting.
Yeah, or like doing my easing off. Yeah. That is
You're trying to reduce the pain dance.
that's amazing.
So again, if I hit this, it's going to go away. So a lot, again,
Yeah.
base of your skull and down here
Well,
where you're
that's where
talking
I
about.
always push and it hurts, and my heart should always try to massage, and it just makes me feel like nauseated because it just doesn't help.
So what we'll do now is we'll go do some other things in a different room, and then we'll pause the video because I'll come back. I'm going to shoot our X-rays. I'm not going to video shooting X-rays, and we'll do something called heart rate variability. You won't see how that's done because she just has to sit here with her hand in this thing for like 3 minutes, and I don't want to sit here and have you
Boring.
watch 3 minutes of just a countdown and her just sitting here
Just
because
have
we
my
have to
hand.
leave. Because when someone does heart rate variability, you don't want anyone in the room. You don't want to influence that because you want to see how the person just does sitting here by themselves and what kind of stress is going on in the body, because this is going to look at sympathetic parasympathetic balance, your stress response, and if the sides of the nervous system are in balance or if one side's off the chart or the other. And that leads to other health issues, or it shows what kind of stress is in the body or how much stress is in the body or how your body's dealing with stress, etc. So
Wow, that's amazing.
yeah, so the reason we do this is because there's the spine, again, and nervous system affect health. And chiropractic, we can go by adjustments how people feel, right? But we also want to look at function. And if we can show people how getting adjusted improves their function and their health, it's just a little more impactful because so many people look at chiropractic as just a musculoskeletal thing as opposed to a health thing and how your body manages stress, how the brain communicates to the body. And this kind of demonstrates some objective measures to look at how through care someone's health improves, not just how they feel. That makes sense?
I have to say, all the doctors and chiropractors I have been to, this is the most thorough, like, kind of exam and looking more deeper into the issue. Does that make sense? Like,
yeah. So you've been to different chiropractors,
oh,
right?
yeah. Well, yeah, since I've been diagnosed with the Scheurmanns, I've tried everything to try to relieve the pain besides taking medication. So, yeah, so I've tried all different, chiropractors and techniques. So, but this is, I've never had, they just made me just do an x-ray and that's it, so this is very interesting.
Cool. Well, I'm glad you're having a different experience here.
Yeah.
We're going to do this scope real quick, too. I'm going to run this down your spine. I have 4 nervoscopes, and all 4 of them have decided to just
Not
work right now. And I have to send them all to get recalibrated. And the other one, the battery just ran out. So I'm sitting here like, what the heck? So just looking for, again, this is reading temperature from each side of the spine. And this is going to narrow down more specifically, like where the subluxation is, where the misalignments. So this needle is going to go one way and break back the other, and there's a little break there. And I'm seeing one right there. Real low, so
I'm going to bend over.
you're good right there. You're perfect, Danielle. You're doing a great job. You're being a great sport. But what I hope is people see this and get some hope. Maybe they're struggling with something and they don't know to do this, or
Yeah.
and I look forward to you getting better. So I already felt the top of her spine. I already know she has a right atlas problem, so I'm just feeling intersegmental, meaning the individual bones. There's gross range of motion when someone just moves, right? And then there's what's called intersegmental. I'm actually isolating the actual vertebra and just feeling that specific one. Like I feel a C2 locked up here on the left. You feel that?
Yeah, what you're thinking, yeah.
I feel an atlas not rotating to the left. I feel scalene spasm right here. I feel trap tension.
She's like, don't stop this.
Yeah.
Down here, just feeling like swelling. I could feel
Yes.
swelling right there.
Right there. Like I said, I know I have the disc issue, but I always feel like it's the muscles overcompensating. Does
Yeah.
that make sense? Yeah.
Yeah. So T1, T2, T3, T4, T5. So you have a T6, T7, T8, T9, 10. And I'm just feeling how this is moving. Like this is not gliding right either. Let's see T6, you got a nice swollen spot right there.
I'm always on my, I basically lay on a heating pad constantly.
Oh,
Right there.
Switch that to ice.
Really?
Oh, yeah.
I don't want,
I knew she was gonna say that.
I'm not an ice person.
Yeah, heat causes inflammation, right, Dr.
Oh,
Dave?
really?
Yeah.
Oh, man.
So
I
it feels
thought-
good while you're
Well,
doing
the
it,
thing
but
is, you have inflammation here, and you don't want to be put. Heat is going to feel good, but it's going to actually create more inflammatory pain.
Really?
Yeah.
Yeah, like right where you're rubbing, like I guess
Yeah,
it's like,
nice
yeah,
and swollen.
I don't even realize it hurts there until, yeah.
I wonder-
The pain I feel is here.
I'm going to bring my arm around you, and I'm going to feel this sacroiliac joint because I think you have a. So she's got a right sacroiliac joint that's locked up too, right?
Oh, yeah. Yep.
I know that feeling.
So I'm going to feel the bottom of the joint, the middle of the joint, the top of it, and it feels worse right there, right? tender there. Not as,
Yeah, it's a little tender. Yeah.
So this is number 1. This is number 2.
Oh, that's crazy. Yeah.
1 is more so, right?
Yeah.
Which is top of the SI joint, so sacrum.
Huh. Now, see, I said something to my one doctor, like, oh, maybe you have bursitis or it's sciatica, or, you know, and they're like, they wanted to give
If
me
they're a
some
doctor and they're saying sciatica, you have if you don't have radiating pain down your leg.
Well,
the back of
sometimes
your
it
leg.
would shoot sometimes,
Sometimes
but
it
like,
shoot.
I have like the pain here, and they're like, oh, maybe it's bursitis, and then they wanted to give me gabapentin and all this, and I
No,
did too much, and
No, it's interesting, like a sacroiliac joint, because the hip attaches into it, can cause a bursitis in the hip.
okay.
But you have a sacroiliac joint problem.
Now, I
definitely.
was told that my one side of my hip is higher than the other.
I'm gonna have you stand up over
Okay.
here. All of it.
So I don't know if that's true. I know like when I held my daughter, I would always hold her on my one side of my hip constantly,
Yeah.
you know, because it was more comfortable.
So
But-
pay attention to what she's saying, because those are signs. We're breaking a gown here.
I'm the Incredible
Do you
Hulk.
want a new one?
Well, of
No,
course,
it's like-
we're gonna need a new one, because, you know, unless we tape it on the,
No, like I would always have to, I always held my daughter, but I always had to hold her on my.
Do you need a new one? They're behind you.
Yeah, this is definitely, this is definitely busted.
It's not
Should I
working.
stop this now, or?
Because I want to go and do an exam in the other room. Yeah, I
Okay.
guess we could stop and resume it over there. Oh. All right, so we're resuming the exam. We just came into the adjustment room to just do a few more things. I'm going to have you step up on this platform,
Okay,
face down. Your face is going to go where the paper is,
okay.
and your hands are going to rest on these.
This is even different than I've never done.
The table's going to slowly go down, okay?
Oh, okay. So like,
So I'm right here.
oh, wow,
I leave the squeak in the table for effect, just to
I
freak
know.
people out a little bit. No, I'm just kidding. So I just scan, all right? Just
Okay.
scan. I'm just looking at body. I'm looking at leg length just to get an idea. Her right leg is shorter than her left leg, right? I don't know if you can see that, but if you want to bring that over here or not, like on top, kind of like this angle. No? Okay.
Yeah, I guess.
Just so you can see, her right leg is shorter than her left. So there's a leg length discrepancy, which could mean a pelvic imbalance. But we already determined she has a right sacroiliac joint problem, which is creating this. I also feel just Achilles tendon, just to see what's happening in here. Because if the feet are off, that's off. What's going on in here is going to throw off the musculature, different tensions on the Achilles tendon. So I just want to feel what's happening. I feel more tension in this Achilles tendon than this side. Sometimes you just bring the legs up to see what happens. Ooh, and look at that. Look at the difference in this. Her right leg, look at that crossover. It's actually longer now.
but am I doing that because of my lower back
No.
pain, or just, it's just doing?
Yeah, no, watch this. It's short here, right? And then I bring this up, and it gets significantly longer.
Wow.
Huge, like an inch or more longer. So that it does indicate. So she doesn't have a leg length discrepancy like an actual anatomical short leg. She has a functional short leg. Stress in the nervous system contracts muscles, and it creates an imbalance. And now this person walks on this all day, and over time we wonder why we get a bursitis of the hip, why we have knee issues, why we have a foot issue or plantar fasciitis or something like that. Remember, symptoms are just signs of dysfunction of something not working right, and we have to identify what the issue is. You can name it whatever you want, but there's a reason why it's occurring. So then I feel knees. I want to feel fibula heads. How are they gliding? This fibula head is not gliding. This fibula head probably is not gliding, and it's not. Right? If I push in here a little bit,
yeah,
it's
that
going to be sensitive, all right? Because it's swollen and it's irritated. And again,
Really?
kinetic chain.
I'm just used to it.
Right, you didn't
That's
even know
just
that
it.
was there, right?
Oh my god, yeah, that really hurts. That's crazy.
I'm going to bring this table up, and then what I'm going to have you do is just turn around on this table. And you're going to turn.
Okay.
Everything's in. You know.
So, make this an
No
X-rated
surprises,
video.
huh?
Okay.
Don't forget the blur vision out.
Yeah.
And I'm being careful, don't worry.
I feel like Frankenstein's wife.
Yeah, you'll get used to it.
I'll be right back.
That's crazy.
Mm-hmm.
I don't know.
And it's all connected on the same side of the scan, too.
Yeah. They have the whole-
Bizarre, right?
That's why I can never hold my daughter, even as a baby or a toddler on this side. I always put all the weight always on that side, but I always thought because they told me years, as a teenager that my one hip was off.
And now I'm just gonna feel feet. I'm gonna get a sense of talus. Both of her taluses are stuck. They're not moving right. I could feel a restriction here. I could feel a restriction there. I feel just general. She's got a navicular that's stuck and that's tender, right?
Oh my God, yes.
She's got a cuboid that's not moving right. And this is the one you broke, right?
Yeah, the toe next to the big one. I thought it was gonna jump out. It was like, the frog, whatever that starts with an F. I really thought it was gonna jump out of my skin, but so far, no. Was the other thing that you touched the nerve or whatever, it made me jump more.
Yeah. I mean, she also has a navicular here that feels stuck. So she's got bilateral taluses, navicular, and a cuboid on this side, as far as feet are concerned.
I'm a mess.
So be working. I'm gonna put this right here, okay? And so what I'm gonna do is lift this up a little bit, and I'm just gonna
Try to
feel
relax,
her knees, medial tibia is not rotating. This is stuck, so I want to work on her medial tibia.
Now, I've always had an issue even as a kid, like my knee will pop out.
Your knee will pop out.
Yeah, and then I just have to it's a freaky feeling, and then I have to,
This knee
yeah, mainly that one,
Mhm.
yeah.
and medial tibia here too. So she just has, again, structurally, just a lot going on. And then I check actually leg length in this position too, and her left leg is short in the supine position. So she's got all kinds of imbalances, neuromusculoskeletal things going on that are creating all these changes in her body. And
Is
she,
this why I'm so tired all the time? Because my body's overcompensating.
well, when you have headaches all day,
Yeah.
or every day, when you have headaches every day, when you're in pain, when you're not sleeping well,
No.
right? So, yeah, you can feel tired. You do that for years, and you're fatigued, you're tired, your body has just had enough.
Yeah.
It's overworked, it's out of balance, it's stressed beyond what it can handle, and it's letting you know. So I'm going to bring you up here, okay?
Wow. That's crazy. Like, I didn't even realize.
And then we're just gonna have you kind of walk. I want to see you walk across the room and back.
How I'm supposed to walk,
No,
or
no,
how I
how you
okay.
normally walk, yeah.
Oh boy. Okay. This is gonna be
I'm
good.
just gonna, let me fix you here, hold on.
Okay.
Okay.
Here, see what I just did? Like, if I'm standing, I push off, like, to take off the. Yeah, okay, so just walk. Okay.
Yeah,
That's a nice brace.
doesn't matter, just watching her walk. Both of her feet are collapsing when she walks, so she's pronating.
So, yeah, I guess. I do things, I guess, to relieve.
All right, yeah.
No, I'm really self-conscious of everything you're saying, like, it's like making sense, so, yeah.
All right, you could stop walking now, that's good.
Okay.
So we identified a bunch of other things going on with her. Again, this is all part of looking, analysis, observation, how is her body working, not working, and our job is to get these things working better. So we're going to probably end this part of the exam, and then the next time we meet might be her first adjustment in a little bit, and then beyond that, yeah, I guess next visit we'll go over all this stuff, look at her scans, look at her x-rays together, and then see how she did after her first adjustment, all right? Hang in there, we'll be back. So we're resuming with Danielle. We just did all of her exam, shot her x-rays, I briefly looked at them. We're gonna go over those another day, but we're just gonna adjust her now and get your process started. So face down like you did before, You're gonna slowly go down. Squeaking all still.
It's like a horror movie, you know. Like
So we determined that we're going to be adjusting her atlas on the right, her neck when we do that last. We're going to be adjusting a couple segments here in her middle back
yeah.
and then lower back, and then do some extremity work, all right? So we're going to go after this 6th dorsal thoracic spine. If that thing's really bothering you,
No, I'm okay.
I mean, you can bring it
Yeah,
down
I'm
a
good.
little bit because we don't want you passing out on film.
It won't be good.
So she's got some interesting stuff on her x-ray, and so I have to get used to your spine a little bit. It's a little flat. It's interesting. It's increased curve here. It's flat up here. So sometimes it's a little uncomfortable and hard to get into a flat thoracic spine. Sometimes we have to put them on a knee chest table. But I'm just going to get into this. First time I'm adjusting her, so I have to get used to her body. She has to get used to me. Your job is to just let your body melt into the table, let your shoulders drop down. You're going to feel me just kind of lean into you and push, okay? Good job.
Holy moly.
Yeah, that was pretty good.
Yeah,
I got some depth into that sucker.
This is good for you as well as for me.
That was yeah, I was
Wow.
let's just say yes.
Wow.
So we're gonna get this T 9, 10. Same thing. Good job.
Wow. Wow.
A little more intense than some
Yeah.
other adjustments.
Yeah. I've never had that done. That was my first.
I'm glad that was your first real adjustment. All right,
I
so
think I can take a deeper breath. Is that weird?
no, not at all. It's going to release tension in your mid-back. Mid-back thoracic subluxation or stress, right, can create tension in the rib cage and prevent rib cage expansion or lung capacity restrictions. So yeah, you could definitely feel.
Yeah, I feel like I can breathe. I don't know.
Yeah.
It's weird. I don't know.
No, absolutely. I have this board in my hand. I'm going to put it under your knee, okay?
Okay.
And your job is to just relax this knee. I'm going to be adjusting the knees because we found that she has, if you saw the rest of the video, she has knee problems. Both her fibula heads are stuck and her medial tibias. So I'm just
Which
going
I
to be...
never knew, really.
Yeah, she didn't know that. So I'm going to be working on them. And I just get on the fibula head here and create a little bit of... The board adds speed to this. You all right down there?
Yeah.
All right. If anything hurts or feels
No,
weird or
it just
uncomfortable,
feels-
just let me know.
Loose.
Doesn't mean I'll stop, but just getting on this fibula head, getting it moving. Same thing. I'm gonna come around to this side.
Oh, boy. That's the one where you hit that one point.
Yes, and you
You said it was
wanted to punch me in the face. And one more. Doing great, Danielle. Check her feet again, like, just get a sense of what's going on in her body, different tensions. So she has right pelvis, we're finding a right sacroiliac joint, right ilium turns out to be, little rotation to her pelvis here.
Oh, it's sore there. Oh, yeah. Like really tender.
Yep. I'm just gonna pump this a little bit just to get some motion into this joint.
Got ya. Oh, it's really tender there. Is that the muscle or a nerve?
No, that's the joint.
Oh.
That's
Yeah.
one of your pelvic bones, your ilium here.
Is it just inflamed or?
Yes. So this misaligns for who knows how long, a long time.
Oh yeah.
There's only ligament that crosses this joint. The muscles are in here, the muscles are the glute, the hamstring, all these other things. And when this joint fails or there's a misalignment, it sprains the ligament, and I'm in the joint. So the joint is swollen, it's irritated, the ligament's probably sprained, and it just weakens this joint.
Yeah.
And then again, it can create hip issue
It's tender in there.
out here.
Yeah.
Iliotibial band gets affected.
Yeah.
So,
Yeah.
so eventually, like, you know, there could be other things like iliotibial band exercises or foam rolling or all that other stuff. Because of the Scheurmann's and the increased kyphosis, pec muscles get shortened. So we might want to do upper cross syndrome exercises and stretches, but she's not ready for that. She just needs adjusting, pain relief, healing, and then do the active stuff as time goes on.
Lots of ice.
Lots of ice.
I know.
So I'm going to bring you up here.
Okay.
And then when the table comes up, you're just going to turn around on your back, okay?
Okay. Oh, okay.
You all right?
Yeah, I'm okay. Whew, okay. I'm telling you, this is like a horror film.
It
Door
is. It's,
shutting, you know? Like, that's a big sound effect.
So I'm just going to be pulling on your toes a little bit. Your job is to relax your whole
Oh,
foot.
I know, I just have a thing about that.
Let everything go. So here's you're on film, so here's your chance to get over it.
I'll give you grief, right? Yeah.
I'm going to bring your leg off this way. You're just going to relax this whole foot. I'm not pulling on your
Okay.
toes this time.
I'm
I am going to be pulling on this talus this way,
Oh,
and you'll feel it separate
Yeah.
like that, right?
it didn't hurt, it just
I felt the
yeah.
joints separate. Same thing here. You're going to feel me just kind of pull this way.
Oh, that was lovely.
It was a little louder. This one has scar tissue in it, probably from previous fracture, stress fracture. So we'll be working on all this stuff. Knees. See what's going on in her knees here. So I'm going to get in this knee. Just kind of. You'll feel me pull this way. And you'll feel a little pop in your knee like that. Same thing here. You're just going to relax. And you're doing great. If not, I'll have Sally poke you in your eyeball. No, I'm just kidding. Let's just do a little figure eight here just to get mobility to the joints. Fix the leopard socks. You're gonna grab my wrists. So I'm just gonna kind of elongate her a little bit since her whole spine is used to being kyphotic and crunched down. You want to just get some elongation to her, lengthen stuff. All right, we're gonna go to this table next, okay?
I don't think I've stretched or did all that kind of stuff in a long time. Okay.
So you're going to lay on your side and face me. Your shoulders are gonna go here and your head's gonna go here.
Okay. In a fetal position or straight?
Kinda, yeah,
Like
fetal
this,
yeah, you're
or-
gonna actually straighten your bottom leg.
Okay.
Bottom, top leg gets bent, bottom leg straight. Good job. Now I'm gonna bring you closer to me, and I'm not gonna drop you on the floor.
It'll feel like he is, but he won't.
So we're gonna go after this right ilium. It's a PIIN ilium. And I know she wants to punch me in the face as I keep hitting it.
It's okay.
So you're gonna feel me stretch you out like a rubber band, roll you towards me,
I can feel that. Yep.
and push, okay?
Oh.
Come on
Yeah.
up.
Wow, it's crazy. Okay.
We're gonna go back to that chair. I'm gonna check that.
Okay. Okay. Which way do you need me to go?
You're gonna
Face that
sit
way?
here and face that way.
Okay.
Face me.
Thanks, Sally. I can only imagine what I look like now after today.
You got a little more mobility of that joint. I'm gonna adjust these shoulders a little bit back this way.
Oh, that one's harder. It hurts more. Yeah.
Again, because of their kyphosis, it shortens everything in the front.
I feel like this one I can't move as much.
Yeah, things get,
Yeah. I don't real. Yeah.
so we wanna eventually,
Open it up more.
yep, open this sucker up.
Got ya.
I'll give you stretches to do to open up your chest, shrink in the back.
Okay.
So I adjust neck sitting.
Okay.
So we're gonna go after this upper right neck sitting.
Okay.
I'm gonna put this seatbelt around you so you don't run away.
Oh, should I be worried? No.
Yeah. Be very scared.
Okay.
Are you nervous?
A little bit, but hey, I've come this far. I can do it.
So you're gonna feel me bring your head to the right, and then you're gonna feel me push that way.
Oh man. Was that as loud as it was in my head?
No, I did not hear it. Usually I do, but I didn't.
Really?
Yeah, and I heard it.
Oh man.
It just you got a lot of stuckness up there. Yeah, you have a lot of stuff going on there.
Are you talking about my neck or my head?
You're-
I know I'm mentally unstable now.
Yeah, so I'm feeling that's just been there so long that
It's just a part of me.
yeah, that was like there's just a lot of tension up here. So the atlas adjusted and moved well. It didn't give a loud audible, but it audibled. She heard the crack, I heard the crack, I felt it. You probably didn't hear it, but
Okay, it's recording.
so we just finished her first adjustment, and we just want to thank you for this whole long video. We appreciate it, and we look forward to doing future videos to see your progress. Right?
Yeah, I
Was
know
that
too.
different than
Oh my God,
anything
like-
you've experienced,
Oh my god, yeah.
chiropractic
Yes.
or anything?
Yes. Anything. Yes, yes. So I'm excited to see what it,
I know she's going to do
Progress.
better. I know her life is going to change. It's going to take a little time. She needs some soft tissue work in addition to adjustments, what I'll be doing on her. But she's going to do great, and we look forward to following up with her. So thanks for watching, and keep in tune with the channel. Like and share.
Yeah.